warm welcome to the distinguished pharmacist present over here. I believe that you have a very great day. So I'm Ashrita, admin manager of Elite Expertise. Elite Expertise is an online education platform which is founded by our directors, Mr. Arief, Mohammad, and Harika Bhimavarapu, who are working as a clinical pharmacist in Australia. They have more than 10 years of experience in the field of pharmacy, and they have more than 6 years of experience in training the students for the various courses like KAPS, OPRA, and for the recently we have launched a course by name PEBC for Canada. Allied Expertise is a brainchild of Arief Sir and Harika ma'am. The main motto of Allied Expertise is to provide the quality education to the pharmacists who wish to migrate to Australia, New Zealand, and Canada, and to mark their expertise and work as a registered pharmacist. Allied Expertise majorly offers KAPS and OPRA for Australia and New Zealand, PEBC for Canada, and PTE English Language Test. So, without any further ado, let's invite Arief sir, our director sir, who will be leading the show, who will be giving the detailed understanding about OPRA exam, how you have to prepare, what are the insights, and what is Elite Expertise is providing to you. Can we have Arief sir, guys?
Thank you so much, Ashrita, and thanks for giving this introduction. And it's a lovely evening for all the members and who have joined for this OPRA workshop. Okay, so I guess you are eager to learn like what are included in this workshop and how we have planned this workshop and what are the things that you need to learn today. Okay, it means that at the end of the day, so what are the main essential things that you need to learn? So first of all, my name is Arief Mohammad, and I'm one of the clinical pharmacists working here in Australia. So I'm working in Northern Health Hospital as a clinical pharmacist, which is in Melbourne. The hospital is in Melbourne. So I have my journey towards Australia is I did my KAPS examination back in 2016. And after clearing the KAPS examination, I moved to Australia in 2017. And then I started my internship. And after doing the internship, then I moved towards the hospital side and I became a clinical pharmacist here. And moreover, I'm also a consultant here, consultant pharmacist. So consultant in the sense like those who give the advice to the doctors, like which medication is to be adjusted and what doses or changes are to be done and so on. So I'm also a consultant pharmacist here in Australia. So today I'm here to share few things, basically the important information regarding this new exam, OPRA exam, and how this exam pattern and it will be. So at first I would like to share a slide with you guys. And so today we are here to learn about this new exam pattern because Australian Pharmacy Council, they have announced that they are going to change the exam from KAPS to OPRA. Okay, so they are going to translate from KAPS to OPRA. So KAPS examination is the, now we are going to conduct the last, APC is going to conduct the last KAPS exam in November. So the coming November is the last KAPS examination, which means that after November, we can't go for the KAPS. So in case if you are planning to become a pharmacist in Australia, then the only way that you need to come is by clearing this OPRA exam, OPRA exam. So OPRA stands for Overseas Pharmacist Readiness Assessment. Okay, so this exam, the Australian Pharmacy Council has introduced to make sure that the knowledge of the overseas pharmacist would be quite equal to the Australian pharmacy practice. And it is not only the knowledge, but also they are trying to assess that whether the candidate is capable enough to start practice in Australia by the time when they come or they migrate here to Australia. And by the time when they start doing the internship. Okay, so let's introduce few important things regarding what Elite Expertise is and so on. And then after doing this introduction, I will go through the case study discussion. So I will discuss one of the case study that I have shared with you guys early this morning. So we will discuss about that case study, and I will also discuss about what is the pattern of the questions that they ask in the OPRA exam. So how we need to prepare for this OPRA exam. So what are the common things that we need to follow and so on. Okay. So this is our website, www.eliteexpertise.com.au. Please visit to our website so that you will come to know a lot of information that what's going on up over there. So we have been providing the training for KAPS examination, which is now going to change to OPRA exam for Australian pharmacist, and we are also providing the training for Australian intern pharmacists who are getting the training here in Australia, and also we are providing the training for PBC for the Canada, and these are the things that we are providing at the moment. So this is our website, and so we both Madam Harika and myself, so we both are the directors here at Elite Expertise. So we both are the directors, and at the same time, we both are the lecturers. So ma'am is working in Monash Hospital, Monash Health in Melbourne, and I'm working in Northern Health Hospital in Melbourne. So we both are clinical pharmacists and we both are consultant pharmacists as well. So we both are clinical and also the consultant pharmacist. So we have been working in the clinical side for the last 5 to 6 years in Australia. So we started we just came up with an idea to start with this training program for for the overseas pharmacists, those who are planning to migrate to Australia. And then we have started the training process for KAPS examination. So this is how our journey started with Elite Expertise. And then, so these are the current programs that we are providing. So we are giving the training for the KAPS, which is going to be as OPRA. So we already started the classes for the OPRA exam as well, OPRA training. So currently for the KAPS and OPRA, both the trainings are going on. And we are also providing the training for the Australian intern written examination. So here in Australia, in order to become a pharmacist, the first step is to clear this OPRA exam or the KAPS, whatever it is. So the first step is to clear the OPRA exam. After clearing the OPRA exam, we need to start working under a supervised pharmacist. We need to start working under the supervised pharmacist, under the guidance of a supervised pharmacist, which means that we need to do around 1,575 hours of internship. Okay. So it is nothing but a supervised practice. So during that internship, there will be 2 more exams that we need to clear. One is the written exam, which is a MCQ based, similar to that of the OPRA. And the other one is the oral exam. Oral exam is nothing but where 2 examiners will be there, and you need to like do face to face. So the examiners, they will give a case scenario, and you need to respond how you need to do. So examiners, they will mainly assess that how you respond. So these 2 are the exams that you need to clear. Then if you clear all these exams, then you will become a fully licensed pharmacist in Australia. But the good thing here is, like, once after clearing this OPRA exam, you can start practicing as an intern pharmacist. So you can start working as an intern pharmacist. And while working as an intern pharmacist, you will be paid. So it is a paid supervised practice. So you will get paid of up to $27 per hour at the moment. So that's the pay rate that you will get. Then we are also providing the training for the PBC Canada. So our first batch for the PBC Canada is going on at the moment. And we started the PBC with the full-fledged plan for 6 months training. So we are giving the 6 months training for PBC exam. Okay. And when it comes to the success rate, no one can beat Elite Expertise success rate. So because we started last year in 2023, and in our first batch, that is the July 2023, we got 90% success rate. Total 89 candidates, they have cleared their exam in July 2023. Then our second batch was in November 2023. And in November 2023, we received a 94% success rate, where 99 candidates have cleared the exam in November 2023. 99 candidates have cleared their KAPS exam. Then our third batch was in March 2024. In March 2024, 121 plus candidates they have cleared, again with the same passing percentage of 94. And the fourth batch was held, recent batch, that is in July 2024. Total 130 candidates they have cleared their exam from Elite Expertise. And Elite Expertise, it keeps everything as transparent. So because there are a lot of other institutes in the world, like they just mentioned that we have so many candidates, they have cleared the examination and so on. But at Elite Expertise, we also put the candidates result certificate, that is the official APC website, official APC certificate in our website. So if you want to cross-check with the candidate if the candidate has really appeared for the exam or if the candidate has passed the exam. So don't hesitate. You can visit our website, and in our website, you can find the certificate of the candidate, which is issued by the Australian Pharmacy Council. Okay. So when we pass the exam, then the Australian Pharmacy Council will issue the certificate, and we will put that certificate in our website. Okay. Then, so now coming to the new exam pattern. So as APC has changed from KAPS to OPRA, that is the Overseas Pharmacist Readiness Assessment. Okay. So this OPRA exam is going to start. The first exam will be going to be, they are going to conduct in March 2025. Okay. So that's the first exam. So let's have a look through what changes that has been done and how this examination pattern it will be, and how APC has divided the syllabus and why they made this change. Okay. So in this slide, we can have a look through OPRA exam. So here, they at the bottom of the slide, we can see that there are 5 major areas where they are going to assess the candidates. So the one of the area is, the first one is pharmacology and toxicology, which counts around 15% weightage. Okay. And then the second one is the biomedical sciences, which contains around 20% weightage. The third area is medicinal chemistry and biopharmaceutics with 10% weightage. The fourth one is pharmacokinetics and pharmacodynamics with 10% weightage. And the last and final one is the therapeutics and the patient care, therapeutics and patient care. So it is the most important one, which carries around 45% weightage. Okay. So now when we check this new curriculum or the new exam pattern that APC is going to conduct. So this new exam pattern, there are few changes that they have made from the old exam pattern, that is from the KAPS exam. So in the KAPS exam, there used to be like 2 papers, paper 1 and paper 2. And in paper 1, the 2 major subjects will be there. One is the chemistry and the other one is the physiology and pharmacology. So chemistry will carry 30% weightage, physiology and pharmacology will carry 70% weightage. Okay, 30 plus 70. And in paper 2, there will be 2 subjects. One is the pharmaceutics and the other one is the therapeutics. Pharmaceutics will carry 30% weightage and therapeutics will carry 70% weightage. So in this way, like 4 major subjects were included, and each subject, like chemistry, 30% weightage, and then physiology and pharmacology, 70%. In paper 2, Sutics 30% and pharmacotherapy 70% weightage. So now APC has completely changed that pattern. Okay. So they have reduced a lot of content from the basic subjects, like from chemistry, they have reduced the content. Okay. And now the chemistry, they have brought it to 10%. Chemistry, including biopharmaceutics, together, now it is only 10%. Okay. So they made these changes because to increase the percentage in therapeutics and the patient care. So now in therapeutics and patient care, the total percentage is 45%. So pharmacology and toxicology, 15%, okay, and therapeutics and patient care, that is 45%. So the reason of this change is mainly to make sure that the candidates, those who were cleared this OPRA exam, so they will be having, or they should be having an enough knowledge to start practicing as a pharmacist in Australia. Okay. So in KAPS examination, they have assessed mainly on the knowledge based, okay, but in OPRA exam, it is mainly on the practice based. Okay. So OPRA exam is completely based on the practice based. Okay. And also when it comes to the assessment, so in OPRA exam, they ask the knowledge-based questions for up to roughly around 55%, okay, or 50 or 55% will be just the basic knowledge-based questions, which means that they will give the simple question like, what is the side effect of amlodipine? It is just a knowledge-based question. Just we can remember, and we can, if we know the answer, then we can put that answer. Okay? And then, such a simple questions they will ask in knowledge base. That is, they are doing 55% weightage for the knowledge based questions. And then the other part of the OPRA exam is mainly about the application part. So when it comes to the application, the remaining percentage, it will come under the application part, where the candidate need to think, the candidate need to apply, need to think about before they answer the question. Okay, so they need to, there will be, like we are expecting, like they definitely there will be some case scenarios as well in the examination, and the candidate, they need to read the case study, and then the candidate need to answer the questions. Okay, so this is how they have changed the examination pattern in OPRA. So they are mainly assessing the not only the basic knowledge of the candidate, but also application skills will be asked more. Okay, so in the case study that we are going to discuss today, as I have already shared that case study, so with that case study you will come to know how the application part it will be. And the other thing for this OPRA is, like in your OPRA exam, total there will be 120 MCQs. Total there will be 120 MCQs, and the exam will be for 2.5 hours. Only one paper, so no more two papers, only single paper, 120 MCQs with 2.5 hour exam time. And out of this 120 MCQs, 10% of the MCQs are unmarked MCQs. It means that there is no marking for those MCQs. Okay? Only 90% of the MCQs will be counted towards the final result, and 10% of the MCQs, the computer, it will remove those MCQs. So like we can, in a simple language, we can say that those 10% of the questions are dummy questions. So the computer automatically, it will remove those 10 dummy questions. But as a candidate, we don't know which one is a real question and which one is a dummy question. Okay, only computer knows which one is the real and which one is the dummy question. So computer will automatically, it will remove those 10 questions. Okay, it means that those 10 questions are not scored. Even though if you have answered correctly for those 10 questions, the computer will remove those 10 questions. Okay, so not 10%, 10% in the sense total, it will be out of 120, it will be around 12 questions. Okay, so it will remove those 12 questions, and you will be assessed only on the remaining 108 questions. So only on the 108 questions, the assessment will be done by the computer. So this is how the exam pattern it will be. Okay, so out of 120 questions, around 12 questions will be the dummy or the unmarked questions. So those questions computer will remove it, but as a candidate, we don't know which one it is. Okay? So it means that you need to answer all the questions, and computer will remove those 12 out of 120. So this is the examination pattern, and these are the core subject areas where you will be questioned, like the questions it will arise from. So these are the 4 core subject areas where the examiners, they will prepare the questions for the examination, for the OPRA exam. Then, so like later on, I will explain in detail about the OPRA. Okay, but now I'm explaining about our Elite Expertise website, as well as our homepage and so on. So in our Elite Expertise websites, you can also go and visit our testimonials, our students' testimonials, and also we do have the demo lectures, the free demo lectures for OPRA as well. So you can visit to the demo lectures link, just click the demo lectures link, and it will show all the demo lectures which are available in the website. And currently now 50 candidates, more than 50 candidates are undergoing the training for intern exam. Okay. So intern exam, as I mentioned, that there will be 2 exams, written exam and oral exam. So currently there are 50 candidates who are getting the training for written and the oral exam. It means that at Elite Expertise, candidates, they are not only clearing their KAPS examination, okay, but they are also progressing further. They are also progressing further with the internship. Okay, so like total around 50 are there at the moment, and by the end of this November, so we are expecting like 30 more candidates, they will enroll for the intern program. That is around 80 candidates are getting trained for the internship. Okay, so it means that the candidates, they are also getting the training for the internship at Elite Expertise. Okay. And in October, we got the exam. for the coming 2 weeks, the next week as well as the following week. So the candidates, they are having the exams now for written exam as well as the oral exam. Okay? And when once the candidates, they do the exam, then the next batch for the interns will also be keep on going. Then, so here is the recent pass out of our intern pharmacist. So they have done their written examination and they have cleared the written examination, as well as they in the July batch, they like around 3 candidates, they have also cleared the oral examination. Only there were around 5 candidates by the time of the July. Only 5 candidates were there with us, but now 50 plus candidates are here with us, who are doing the internship and the intern written and oral exam training. Then, so the services what we offer here is at Elite Expertise. So we take the live lectures. We take the live lecture, and each lecture will be for around 2 hours, more than 2 hours. Okay, so we take the live lectures, and all our lectures will get recorded, and it will be there in the app, Elite Expertise app. Okay, which means that in case if you can't attend the live lecture, you can watch that recorded lecture later on at any time as per your convenience. And we take at Elite Expertise, we take like more than 80 plus lectures for each batch. Okay, for each batch, we take more than 80 plus lecture. And if you calculate the hours, the number of hours at Elite Expertise, we spend more than 300 plus hours. For each batch, we are spending more than 300 plus hours for teaching the KAPS and also for the OPRA. So we will spend more than 300 hours with the students. Okay, so nowhere else in the other institutes. So if you can compare with other institutes, they will do it only for 60 hours or hardly up to 100 hours. Okay, and they will just wind up. But we will do a lot of revisions, especially 1 month before the exam. The candidates, they will be with us like early morning. They need to wake up at 9 o'clock. They need to have the breakfast quickly 9 o'clock, and they need to join the lectures. And the lecture will end like we'll keep on taking the lectures, and for every 2 hours we will give half an hour break or 1 hour break, and then again in the afternoon, again in the evening, again at night time, till 9 p.m. from morning 9 a.m. to till 9 p.m. So they will be completely engaged with us. Okay? So it means that we'll be doing a lot of revisions. Okay? And we'll be explaining each and every MCQ in detail. So, and also the other thing, we do have the mocks at Elite Expertise mocks. And these Elite Expertise mocks are simulated to that of your final examination. It means that if you practice the mocks, okay, then these mocks will help you in answering the final exam questions. Okay, because these mocks are simulated similar to that of the final examination pattern. Okay, and all the mocks that we conduct will be the timer based. Okay, and it will be similar to that of your final exam, how the final examination, it will be as a timer based, and our mocks are also timer based mocks. And at the same time, we provide the complete handouts at Elite Expertise. The complete handouts will be provided to the candidates, and we also give assignments to the candidates. Okay, so you don't find this type of the things in other institutes, but at Elite Expertise, we also provide the assignments for the candidates. So the candidates need to do the assignments, and they need to submit the assignment answers before the deadline. Okay, then not only the assignments, we also do some team push activities for the candidates. Like we'll ask the candidates to collect the keywords after completing each lecture. So the candidates, they must collect all the important keywords from that lecture. Okay. And these keywords also, they need to keep on submitting it to the group. So there will be one group for each candidate, for 20 or 25 candidates, there will be one group. So in that group, the candidates, they need to keep on submitting their keywords. Okay? And finally, we will go through all those keywords, and also we will discuss about the answers for the assignments. And also we will discuss each and single MCQ in the mocks. Okay? So this is how we train the students, and that's the main reason why we are getting that huge success rate of 94% in each batch, like more than 120 plus, 130 plus. And even for the interns, now there are 50 plus candidates are there who are getting the training. And as I mentioned that we still got a lot of applications for the intern training at the by the end of November. So this number will go up to it will definitely it will cross 80 plus. Okay. And then so we do have the Elite Expertise YouTube channel. If you haven't subscribed to Elite Expertise YouTube channel, please subscribe to our YouTube channel, because we will keep on providing a lot of information in our YouTube channel, and we'll be updating you regarding regarding the pharmacy practice things, not only in Australia, in New Zealand, and also in Canada, in US, UK. So everywhere, so we'll be updating you with a lot of information. Okay. So this is our YouTube channel, Elite Expertise YouTube channel. Please subscribe to our YouTube channel if you haven't been done so far. So thank you so much. So this is the first presentation that I would like to give to you regarding what Elite Expertise and so on. And now I'm going to discuss, I'm going to give that demo lecture that what we have presented it to you in the group, in the WhatsApp group. So we have presented a case study to you in the WhatsApp group. So I'm going to discuss that case study and how, like, what type of the questions that we can expect in the OPRA exam. So those things also the sample questions that I'm going to discuss it with you guys now. Okay. So I'm sharing the slide. Okay. So, well, this is the case study that I have shared with you in the WhatsApp group. And I guess most of you might have gone through this case study. Okay. And this is the case study that I'm going to discuss it with you now. Okay. So here, the case is about, like, it is a live case that happened in the hospital where I was working, where I'm working at the moment. Okay. So, like, last year, one of the patient has got admitted in the hospital, and the reason why he got admitted and what happened exactly. So everything that I would like to present in this scenario or in this case. So his name was not Bob. Okay, I just put the name as the Bob, but his name is something X. Okay, that we are not allowed to reveal. So he was a 62-year-old male. He got admitted in the hospital with the symptoms of confusion, delirium, and disorientation. So he developed this confusion, delirium, and disorientation. And his medical history includes he has the asthma problem, he has diabetes condition, he has hypertension, and also the sleep disturbance like insomnia issue. He has asthma, diabetes, hypertension, and insomnia. And upon admission, he has the SOB, that is the shortness of breath problem, dyspnea with mental confusion. So he was completely confused. Okay, so he was completely confused, and he had this delirium issue as well. That delirium is not, but he was unaware that what's going on around his surroundings. Okay, and completely disoriented. And when he admitted in the hospital, his vital signs were his respiratory rate was 16 breaths per minute. Initially, it was 16, but later on, within 1 hour, his respiratory rate went up. It went up to 23 breaths per minute. Okay, so normally in a any person, in a healthy person, for us, the respiratory rate should be between 15 or 20. 20 is the maximum. Okay, so even it won't go up to 20. We can say that 12 or 14 or 15 or 16, but for that person, the respiratory rate, it went up to 23 breaths per minute. Okay. Then his heart rate was 94 beats per minute and temperature was 98.5, which was quite normal. He hasn't got any fever. And when he got admitted, his medications were, his current medications were, he was taking irbesartan 75 milligram once daily for his blood pressure problem. Okay, so for the management of the hypertension, he was taking the irbesartan 75 milligram. And he was on metformin for his diabetes. Okay? He's taking metformin 1 gram twice daily. So for the management of the diabetes, he was on the metformin, 1 gram twice daily. And he also has the asthma problem. For the asthma, he's using the Symbicort puffer. So Symbicort is a combination of budesonide with formoterol. So budesonide is a steroid, and formoterol is an example for LABA, long-acting beta agonist. Okay? So he's on budesonide with formoterol, 100/3 strength, 2 puffs twice daily for the management of his asthma. And he is also taking the Ventolin, that is the salbutamol, 100 micrograms, 2 puffs when required for the asthma. So whenever he's getting the shortness of breath problems, then he was using the salbutamol puffers. Okay, he was using the salbutamol puffer. And he's also on diazepam tablets. So diazepam, he's taking diazepam 5 milligram tablet for his insomnia issue. So he started taking the diazepam 5 days before he admitted in the hospital. Okay? So just 5 days before he got admitted in the hospital, he started taking this diazepam. He went to one of the GPs and he complained about this insomnia problem. He's said that he's not sleeping well. He's getting difficulty to sleep. Then the doctor had prescribed him on diazepam 5 milligram tablets. So these are the medications that he was on. Like, as he has the hypertension problem, that's why he's on irbesartan for the blood pressure. As he has the diabetes, so that's why he's on metformin for his blood sugars or the diabetes. And as he has the asthma problem, he was taking the Symbicort puffer, 2 puffs twice daily. So 2 puffs in the morning and 2 puffs in the evening. And as he also has the asthma problem, whenever he is getting this asthmatic attacks, so he's using some Ventolin, that is the salbutamol puffer when required basis. And as he has this insomnia issue, so he started taking this diazepam tablets, diazepam 5 milligram tablets. Okay. Then these are his current medications. Okay. And soon after his admission, whenever the patients they get admitted in the hospital, like what we do in the hospital is, what the doctors they do in the hospital is, so they will check the vital signs first. Vital signs in the sense heart rate, respiratory rate, okay, as well as temperature, and they will also check the urine output, and then they will have a look for the lab test. So they will perform all the lab tests. So lab test, they have sent the blood samples for the lab test, and within 1 hour we got the lab test reports. Okay. When we got the lab test reports, his pH, the blood pH was 3.71. Normally, our blood pH should be, sorry, the blood pH was 7.31. Okay. Normally, the blood pH should be 7.36 to 7.44. It should be between 7.36 to 7.44, but his pH was 7.31. Okay. So this is the normal range, 7.36 to 7.44. Even a slight change in the pH, even a slight decrease or increase in the pH, our body can't sustain. Okay, our body can't tolerate even a small decrease in the pH value or a small increase in the pH value, then our body can tolerate. A small decrease in the pH value will lead towards the acidosis condition, and a small increase in the pH value will lead to cause the alkalosis condition. So our body can't tolerate even a slight change in the pH of the blood occurs. Okay? So the pH of the blood always it should be between 7.36 to 7.44, or it can go up to 7.35 to 7.45, but not less than 7.35. But for him, the blood pH it dropped to 7.31. Okay, so which means that the blood pH is going towards acidosis condition, okay, towards the acidic condition. The pH is going towards the acid levels, okay, towards the acidosis condition. Or if the blood pH crosses 7.45 and if it reaches to 7.48 or so on, then we'll tell it as the pH is increasing and it is going towards the alkalosis condition. Okay. So here the patient's blood pH is, the blood pH was 7.31. And the partial pressure of carbon dioxide, in his blood was 57 mm of mercury. it was 57 mm of mercury. So normally in our blood, when we take the blood, arterial blood, and we check the partial pressure of the carbon dioxide and the partial pressure of the oxygen, the partial pressure of carbon dioxide should be only 35 to 45. The maximum should be 45 mm of mercury. But for him, the carbon dioxide level, it went up to 57 mm of mercury. And the oxygen partial pressure should be 90 to 100 mm of mercury. But for him, the partial pressure of oxygen has dropped to 60 mm of mercury. Okay. So these were the lab results when we took the lab test, when the lab test was done. So these are the lab reports that we have got. Okay. So blood pH is decreased, that is acidosis condition, and the carbon dioxide levels in the blood has been increased, and the oxygen, partial pressure of oxygen has reduced. Now, from this case, what are the key findings or the important findings? When it comes to the symptoms of the patient, when he got admitted to the hospital, he has the shortness of breath, that is dyspnea. Okay? He has the shortness of breath, which condition is known as the dyspnea. And he has the confusion. He was completely confused, and he had the delirium. Delirium is nothing but he was lack of awareness. He doesn't know that what's going on around him. So that condition is known as the delirium and disoriented. Okay. So these were the symptoms that the patient has presented on the day of admission. Then his medical history. So his medical history was he has the asthma problem, diabetes, hypertension, and sleep disturbance, that is insomnia. And his medications were he was taking ibuprofen, metformin, Symbicort for his asthma, and diazepam. Okay. And his lab abnormalities. His pH is 7.31, which is reduced. The normal value should be 7.36 to 7.44. Okay. But his blood pH has been reduced to 7.31. His partial pressure of carbon dioxide in the blood is 57 mm of mercury, but normally it should be 35 to 45 mm of mercury. And the partial pressure of oxygen in the blood is 60 mm of mercury, but normally it should be 90 to 100 mm of mercury. Okay. So these were the findings through which he got admitted in the hospital. Okay. So these were the conditions through which he got admitted in the hospital. Okay. So now, based on this case, let's discuss what is meant by this acid base. Okay. So here it clearly indicates that his blood pH has been reduced. Blood pH has been reduced. So we need to know what is the reason, exact reason why his blood pH has reduced, why his partial pressure of carbon dioxide is more, and why his partial pressure of oxygen is less. And also I said that when he got admitted, his respiratory rate was 16, but within 1 hour, his respiratory rate, it went up to 23 breaths per minute. What is the reason why he was hyperventilated? Okay, why his respiratory rate has been increased? Okay. So these are the things that we can have a look through a topic which is known as the acid-base imbalance or the acid-base imbalance, and why the acid-base imbalance will occur in our body. Okay. So acid-base imbalance, will tell it as the acidosis or alkalosis condition. Okay. And there will be two types of the acidosis and alkalosis condition. One is the respiratory acidosis and respiratory alkalosis. And the other one is metabolic acidosis and metabolic alkalosis. So one is the respiratory one. We'll tell it as the respiratory, whether it can be the acidosis where the blood pH will reduce, okay, or respiratory alkalosis, again where the blood pH will increase. Then metabolic acidosis where the blood pH will reduce, and metabolic alkalosis, again the blood pH will increase. Okay. So in this way, there will be two major reasons, two major factors for acidosis and alkalosis. Either it can be the respiratory or it can be the metabolic. Okay. Respiratory means where the lungs are involved. Metabolic means where the bicarbonate ions excretion is involved. Okay. So that condition is known as a metabolic condition. So now we are going to have a look what is meant by this respiratory acidosis and respiratory alkalosis, and how our lungs, they play a major role to bring back the pH into normal state. Okay, so at first, in case of the acidosis means the blood pH will be reduced. Okay, so the blood pH will go down. So here the blood pH is 7.31. The normal should be 7.36, but his blood pH has been dropped to 7.31. Okay. So that condition is known as the acidosis condition. His blood pH has been reduced. So whenever the blood pH is reduced, what is the reason why the blood pH has reduced in this patient? Okay. So the blood pH has reduced because in this patient, the carbonic acid, okay, the carbonic acid has been increased. Okay, so the formation of the carbonic acid has been increased. So why the carbonic acid has been increased? So if you can have a look in this slide, so you can see that when the carbon dioxide levels are high in our blood, then this carbon dioxide, it will readily combine with the water and forms the carbonic acid. Carbon dioxide will combine with the water and forms the carbonic acid. And this carbonic acid, it will give the protons. As a result, the blood pH will reduce. Blood pH becomes more acidic and the blood pH will drop. So that's what it happened in this patient. So in this patient, when you have a look, what is his partial pressure of carbon dioxide? His partial pressure of carbon dioxide is 57 mm of mercury. The normal should be only 35 to 45, but his partial pressure of carbon dioxide is 57 mm of mercury. Okay? Which means that his carbon dioxide levels in the blood has been increased. And this carbon dioxide has readily combined with the water and it has formed the carbonic acid and the blood has become acidic. So the blood pH has dropped. Okay. Now, how our body reacts in case of the acidosis condition, in case of the respiratory acidosis. Now, this condition is known as the respiratory acidosis condition. So in case of respiratory acidosis, the main factor that we measure is the carbon dioxide. If the carbon dioxide is increased in the blood, then we'll tell it as respiratory acidosis. If the carbon dioxide levels is reduced in the blood, then we tell as respiratory alkalosis. Okay. So respiratory acidosis means the carbon dioxide will be increased in the blood. Increase in the partial pressure of carbon dioxide in the blood will lead to cause respiratory acidosis, and decrease in the partial pressure of carbon dioxide in the blood leads to cause respiratory alkalosis. Now, it is quite clear that in this patient, in Bob, when we measured his blood pH, the blood pH is reduced, but we don't know what is the reason. Initially, we don't know what is the reason. So why the blood pH is reduced, why he has the acidosis condition. But when we look at the partial pressure of carbon dioxide, his partial pressure of carbon dioxide is increased. Okay? So when the partial pressure of carbon dioxide is increased, then we confirm that it is a respiratory acidosis condition. It is a respiratory acidosis. Then what happens, how our lungs, they respond for this respiratory acidosis? So whenever there is a acidosis condition occurs, respiratory acidosis occurs, that is the acid levels get increased in the body, in the blood, then immediately our brain, that is the medulla, the impulses will be sent to the brain, especially to the medulla oblongata. Then medulla is the center in the brain which controls the respiratory rate, and medulla is the center which controls the heart rate. Okay? Medulla is the center which controls the respiratory rate as well as the heart rate. Now, medulla oblongata, what it does is it will send the impulses back to the lungs. Okay? It will send the impulses back to the lungs, and it will increase the respiratory rate. It will increase the respiratory rate. Okay, so why the respiratory rate should be increased? That's the important point here. Okay, so here the respiratory rate should increase to excrete out the carbon dioxide, to remove that carbon dioxide. The respiratory rate will increase to remove that carbon dioxide from the blood. Okay, and to get the more oxygen. Now I will explain you. I will explain how the respiratory rate is associated with removing this carbon dioxide and what happened in this patient initially. So let's assume that you take a deep breath. Okay? After taking a deep breath, hold your breath. Don't exhale it out, hold your breath. Okay? How long you can hold your breath? Maximum up to 30 seconds, or up to 40 seconds, or up to 45 seconds, or maximum up to 50 seconds, or if you have the more capacity, you can hold up to 60 seconds, but not beyond that. So what happens when you hold your breath for 50 or 60 seconds? So when you hold your breath, try once when you breathe, take a deep breath and try to hold your breath for 45 seconds or 50 seconds. Okay? Then what happens? your body, your face will start flushing. Okay? So you can't concentrate on what's going on in the surrounding. So you will be completely unaware of what's going on. Okay? Because the carbon dioxide level in your blood has been increased. Okay? Your body now, your blood is completely rich in carbon dioxide. So that carbon dioxide levels which are increased in the blood, so it leads to cause the disorientation. It leads to cause the disorientation or delirium, that is, which means that you will be unaware that what's going on. Immediately you need to start breathing. So after 45 seconds, what you will do, you will take a rapid breathing. You will start rapid breathing, that is, the ventilation rate will increase, your breathing rate will increase. Okay? So why it happens, why we become completely disoriented, why we go into a delirium state, why we'll be unaware of our surrounding, that is mainly because of the accumulation of carbon dioxide. So that carbon dioxide levels have been increased in the blood. So due to increase in the carbon dioxide levels, acidosis has occurred. And due to that acidosis, the blood pH has reduced and our body was unable to tolerate. So that's why we can hold our breath maximum up to 40 seconds, up to 45 seconds, or up to 50 seconds, or up to 60 seconds. But after that, what happens? We can't tolerate it. Our body can't tolerate it. Okay. So we will be completely become unaware of what's going on. Okay. So this is what it happens. Okay. So this is what it happened with Bob as well. This is what it happened with the Bob as well. So he was completely confused. He was in a delirium state. Okay? That is, he was lack of awareness and he was completely disoriented. And I told you that soon after getting admitted in the hospital, his breathing rate, that is the respiratory rate, it went up to 23, 24 breaths per minute. So why the respiratory rate is increased? So by increasing the respiratory rate, by increasing the breath or the respiratory rate, so we are trying to exhale out that carbon dioxide. We are trying to remove out that carbon dioxide from the body. So what happens? Why we need to remove that carbon dioxide? That's the question here. So if we won't remove that carbon dioxide, then that carbon dioxide will keep on combining with the water. It will keep on combining with the water and it will keep on forming the carbonic acid. So further acid will keep on producing and our body will become completely acidic state, and the pH will keep on dropping. pH will keep on dropping from 7.31 to 7.30, 7.29, and so on. Okay. So that's why the respiratory rate will increase to exhale out that carbon dioxide. Okay. So that's what it happens in our body. And that's what it happened with the Bob. So his respiratory rate has been increased. When his respiratory rate has increased, then the carbon dioxide level will get reduced. Okay. So carbon dioxide will be removed out from the body. Okay. When the carbon dioxide is removed, then no more carbonic acid. So no more formation of the carbonic acid. Okay. So in this way, the patients, like our body, will respond towards the acidosis condition and our body will remove that carbon dioxide and our body will reduce this acidosis state. Okay. And finally, our body will bring the blood pH back to normal. That is, it will increase the pH and it will bring the blood pH back to 7.35 or 7.36. Okay. So this is how it occurs naturally in our body, that how our body will respond. Okay. So this is what it happened with Bob when he got admitted in the hospital. Okay. And there are certain factors that were involved with his acidosis condition. So those factors that I will explain you, what are the other factors. Then on the other hand, when we talk about the alkalosis, alkalosis is quite opposite. Whenever the blood pH has been increased, then we'll tell it as the alkalosis state, alkalosis condition. Then when the alkalosis condition occurs, then again, the medulla oblongata will get stimulated, but this time medulla, it won't increase the respiratory rate. It won't increase the respiratory rate. It will decrease the respiratory rate. So let's say, for example, if initially the patient is breathing 16 breaths per minute, then the respiratory rate will drop to 12 breaths per minute or 10 breaths per minute. So why the respiratory rate need to decrease? Because our body need to conserve the carbon dioxide. Our body need to reserve that carbon dioxide. Why the body need to reserve that carbon dioxide? So that the carbon dioxide, if the respiratory rate is more, then the carbon dioxide will be exhaled out. But if respiratory rate is less, then the carbon dioxide will remain in our blood. And that carbon dioxide can easily combine with the water and form the carbonic acid. And when once the carbonic acid is formed, okay, so the carbonic acid levels will get increased. And when once the carbonic acid is formed, then the blood pH will drop. The blood pH will drop from 7 point, let's say for example, initially the blood pH has went up to 7.48. From 7.48, it will come back to 7.44. And again, it will be maintained or it will be stabilized. So in this way, respiratory acidosis and respiratory alkalosis, when we are talking about the acidosis and alkalosis, especially with the respiratory, we are talking mainly about the carbon dioxide. Carbon dioxide, carbon dioxide, carbon dioxide. Okay. So in acidosis, carbon dioxide levels is increasing in the blood. So that's why the blood pH is reducing. In alkalosis, carbon dioxide level is reducing. So that's why the blood pH is increasing. So in acidosis, to compensate how our lungs are functioning, our lungs are increasing the respiratory rate. Increasing the respiratory rate to remove this excess carbon dioxide, which is present in our blood. Okay? And finally, they will reduce the pH of the blood. And in alkalosis, our respiratory rate will drop, our respiratory rate will decrease. Okay? If the patient is breathing 16 breaths per minute, and whenever they get this alkalosis condition, then their respiratory rate will drop to 12 or 10 breaths per minute, due to which the carbon dioxide will remain in our blood, and that carbon dioxide can easily combine with the water and forms the carbonic acid. And again, the blood pH can be reduced. It means that the blood pH can be brought back from 7.48 to 7.44. So this is what it happens in case of respiratory acidosis and respiratory alkalosis. Then when it comes to the metabolic conditions, so there will be two types, as initially I mentioned. There will be respiratory and metabolic. Respiratory acidosis, alkalosis, and metabolic acidosis and alkalosis. So when it comes to the metabolic condition, again in metabolic, there will be acidosis and metabolic alkalosis. But here, when we are talking about the metabolic acidosis or alkalosis, so we are not concerned about the carbon dioxide. So we are not concerned about the partial pressure of carbon dioxide. Rather than we are concerned mainly about the bicarbonate levels. We are mainly concerned about the bicarbonate ions. So bicarbonate ions are the most important one that we need to consider when we are talking about the metabolic acidosis and metabolic alkalosis. So in case of metabolic acidosis means increase in the proton H+ ions and the loss of bicarbonate ions from the body. Okay? So loss of bicarbonate, we'll tell it as the acidosis state. So whenever the bicarbonate levels in the blood are reduced, then we'll tell it as the metabolic acidosis. So what happens here? The bicarbonate levels will be lost. So due to the loss of the bicarbonate, our blood pH will drop. Our blood pH will decrease. Okay? So when the blood pH is reduced, again, now two organs will play a major role. Okay? Even here, in case of the respiratory acidosis and respiratory alkalosis, initially I mentioned that our lungs will play a major role to bring back the pH back to normal. But once the lungs they played the role, now the long-term role will be played by the kidneys. Okay, there are two organs in our body. They always try to maintain acid-base balance. Two organs, they always try to maintain the acid-base balance. One is the lungs and the other one is the kidneys. Okay. So lungs, they will try to act initially. At first, the main organ that plays a role either in case of acidosis or in alkalosis will be our lungs. So the lungs, they will start acting immediately, followed by the kidneys. So kidneys, they will also start showing the action, but the action will be slowly. Okay? They will show a slow action. That is, it takes at least 2 to 3 days time. It takes at least 2 to 3 days time for the kidneys to correct the acid-base imbalance. For kidneys, it takes at least 2 to 3 days time to correct this acid-base imbalance. But for lungs, immediately they will start showing the action and they will try to bring the blood pH back to normal. But what will be the action that the lungs that they try? It is only for a short term. Okay, so it's only for the short term, which means that here we are talking about the increase in the respiratory rate. Increase in the respiratory rate. In case of acidosis, the lungs will increase the respiratory rate. Okay, so how long the patient will keep on increasing the respiratory rate? Okay, so they can't breathe for 24 breaths per minute for a long term. Okay, so only for a short term, only for a few hours, the lungs they can show the action, and the lungs they can try to correct this pH. Okay, but kidneys, when once the kidneys they start showing the action, then that action will remain for a long term. That effect will remain for a long term. Okay. So here, again, in case of the metabolic acidosis, at first the lungs they will show the action. So because we are talking about the acidosis, acidosis means again decrease in pH. Decrease in pH means how the lungs they can correct that decreased pH, how the lungs they can bring back the pH back to normal. The only thing the lungs that they can do is they can increase the respiratory rate. They can do the hyperventilation. They can increase the respiratory rate. Due to increase in the respiratory rate, all the carbon dioxide which is present in the blood that can be removed out. Okay? The carbon dioxide will be removed out. So by removing the carbon dioxide, at least we can try to limit the formation of carbonic acid. By removing that carbon dioxide, at least we can try to restrict the formation of carbonic acid, and we can try to restrict further drop of blood pH. We know that the main culprit is bicarbonate. We must correct this bicarbonate. But at least for a short term, for a time being, what lungs they are doing? For the time being, lungs they are removing this carbon dioxide. Lungs they are removing this carbon dioxide, and lungs they are preventing the formation of the carbonic acid. Okay, so with that, immediately the lungs they will try to correct this blood pH. The lungs they will try to correct the blood pH. So either in case of respiratory acidosis or metabolic acidosis, it doesn't matter. The first organ that takes place, the first organ that step in will be lungs. Only the lungs will play the major role. Then the next organ which shows a sustained action, sustained effect, slow action, but a long-term effect, long-term result will be played by the kidneys. So here kidneys, they will keep on reabsorbing the bicarbonate ion, sorry, not the carbonic acid. So it is the bicarbonate HCO3 minus. Okay. So sorry for that. It is HCO3 minus, okay, not H2CO3. So kidneys, they keep on reabsorbing the bicarbonate ions. Okay. And the kidneys, they will excrete the protons. At the nephrons, they will keep on reabsorbing the bicarbonate, and the nephrons, they will keep on excreting the protons. In this way, finally, the blood pH will be increased and the blood pH will be brought back to 7.34 to 7 point, or 7.35 or 7.36 to 7.44. Okay. So in this way, in metabolic acidosis, at first lungs will play the action, then kidneys will play the major role. Major role, how the kidneys they will play the major role? By reabsorbing the bicarbonate and by excreting the protons, H plus ions. On the other way, on the other hand, quite opposite. In case if it is a metabolic alkalosis condition. So when we are talking about metabolic condition, means we are talking mainly about the bicarbonate. So in case of acidosis, metabolic acidosis, loss of bicarbonate or decrease in bicarbonate. Whereas in case of alkalosis, metabolic alkalosis means loss of proton or gain of bicarbonate or increase in the bicarbonate. Okay, so increase in the bicarbonate leads to cause the metabolic alkalosis. So when it is alkalosis, then the blood pH will increase. Obviously, pH will increase in alkalosis condition. And in alkalosis, what happens now? How the lungs they respond? Now the lungs they do a hypoventilation. So they will reduce the respiratory rate. Okay? The respiratory rate will drop from 16 to 12 breaths or 10 breaths per minute. Why the lungs they are reducing the respiratory rate? Again, to reserve that carbon dioxide in the blood, to conserve that carbon dioxide in the blood. If the carbon dioxide is present in the blood, then carbon dioxide can easily combine with the water and it can form the carbonic acid. Okay? So by forming the carbonic acid, again, it can reduce the blood pH. It can bring the pH back to acidic condition, sorry, back to the normal state from 7.48 to 7.44, okay, or 7.35. Okay. So in this way, by hypoventilation, the lungs, they will try to conserve the carbon dioxide, and the lungs, they will try to decrease the blood pH. Okay. And again, the kidneys, they will play the role here. So here, what we are talking about the gain of bicarbonate. So bicarbonate levels are more. In metabolic alkalosis, the bicarbonate levels are high. So now kidneys, they will excrete out the bicarbonate and they will reabsorb the protons. So in this way, kidneys, they will decrease the pH. So this is how it occurs in our body. Okay. In case of respiratory acidosis and respiratory alkalosis, and metabolic acidosis and metabolic alkalosis. So when it comes to respiratory, so we are talking mainly about the partial pressure of carbon dioxide. In respiratory acidosis, the partial pressure of carbon dioxide will be high. So that's what it happened in case of Bob. His partial pressure of carbon dioxide, it went up to 57 mm of mercury. And as it is acidosis, his blood pH has been dropped. It went to 7.31. Actually, it should be 7.35 or 7.36, but his blood pH has been dropped to 7.31. And as it is respiratory acidosis, then he was completely confused because the acid levels has been increased and the carbon dioxide is more. So that's why he was completely confused, disoriented, and he was unaware of his surroundings. Okay? And finally, what happened? His respiratory rate has been increased. So soon, within 40 minutes, I think so, his respiratory rate has started increasing. His respiratory rate went up to 23 or 24 breaths per minute. Okay? So the reason why his respiratory rate is increased, to excrete out the carbon dioxide. If the carbon dioxide is excreted and if the blood carbon dioxide is reduced, then formation of carbonic acid in the blood can be decreased. So then the pH will be increased and the pH will be brought back to normal. Okay. So this is how it happens in case of the respiratory acidosis and respiratory alkalosis. And in case of metabolic, when we are talking about the metabolic acidosis and alkalosis, so we are concerned mainly about the bicarbonate. We are concerned mainly about the bicarbonate. A loss of bicarbonate is metabolic acidosis, and the gain of bicarbonate or the increase in the bicarbonate is metabolic alkalosis. So acidosis, what happens? Again, first organ that should play a major role will be the lungs. Again, the lungs, they will involve. Lungs will increase the respiratory rate. Why the lungs are increasing the respiratory rate? The bicarbonate. Why the lungs? They need to remove the carbon dioxide. At least by removing dioxide, the lungs, they can prevent the formation of carbonic acid. And by preventing the formation of the carbonic acid, at least we can try to limit the blood pH. We can try to prevent further decrease in the blood pH. Okay? Or we can try to slightly, we can bring the blood pH back to normal. But as lungs, as I mentioned, that they can't play a major role. Always the lungs, they can't play a major role. So they will show the action only for a short term. They will show the action only for a short term. Okay? But the major organ which plays a important role will be the kidneys. So here again, the kidneys will be involved. The kidneys, they will reabsorb the bicarbonate and they will excrete the protons. And finally, they will increase the blood pH back to normal. The same thing, it happens in case of the alkalosis, which is quite opposite to whatever be the steps that we have seen in acidosis. So in case of alkalosis, blood pH will be increased. So as a result, hypoventilation will occur in the lungs and carbon dioxide will be conserved, and that carbon dioxide will combine with the water and it will form the carbonic acid. But that carbonic acid, whatever it is formed, it won't correct the complete blood pH. Okay, so the carbon formed by the hypoventilation, it can't correct the complete blood pH. Then the kidneys will be involved and kidneys will excrete the bicarbonate and kidneys will reabsorb the protons, and finally they will reduce the blood pH and they will bring the blood pH back to normal. Now, what are the causes for this metabolic alkalosis and metabolic acidosis? So when we look at the causes for the metabolic alkalosis first, if the patient is taking any diuretics in the sense like thiazide diuretic or a loop diuretic like furosemide, then if the patient has been using a high doses of the diuretics, regular diuretics, then the patient will be at a risk of developing metabolic alkalosis. Or in case the patient has the vomitings, severe uncontrolled vomitings, whenever we have the vomitings, severe uncontrolled vomitings, then what happens is from our stomach, whatever be the hydrochloric acid that is formed, all that hydrochloric acid will be expelled out. All the hydrochloric acid will be removed out. So due to continuous vomitings, all the HCl, hydrochloric acid, will be removed out. And as a result, we'll get the metabolic alkalosis condition. Due to the lack of the acid levels, the chloride ions will be expelled out, and there won't be sufficient chloride to form the and the protons will levels will get reduced. Okay, so finally it leads to cause the metabolic alkalosis in case of severe vomiting. But when it comes to the acidosis, whenever we have the severe diarrhea condition, okay, so in case of severe diarrheas, we'll develop the acidosis, metabolic acidosis. And in case of diabetes, where especially in type 1 diabetes, the patients sometimes they may develop the diabetic ketoacidosis. In case of diabetic ketoacidosis, what happens is in their blood, the ketone body levels will increase, and it is an acidosis condition. Okay? And that acidosis is a metabolic acidosis. And lactic acidosis, whenever the lactic acid levels gets increased in our body, lactic acid levels increase in the lactic acid in the sense whenever there is an anaerobic environment will be present in our body, anaerobic condition is present in our body, then the lactic acid levels will get increased, and it leads to cause the metabolic acidosis. And in case of certain toxicities like salicylic acid toxicity, okay, in case if the patient has the salicylic acid, that is the aspirin overdose, then we know that aspirin is an acidic drug. So it leads to cause the metabolic acidosis. So all these are the conditions which will lead to cause the acidosis, and diuretics and nausea, vomiting, not the nausea. If they have the severe vomitings and the loss of acid, then they will develop the metabolic alkalosis condition. Then in a similar way, for respiratory acidosis, the main factors are, one is the asthma. Okay, so patients, those who have the asthma, they are highly prone to develop the respiratory acidosis. And patients, those who have the COPD, that is the chronic obstructive pulmonary disorder, so they will be prone to develop the respiratory acidosis. And patients, those who have the sleep apnea problem, sleep apnea in the sense at night time, they will wake up, all of a sudden they will wake up because they can't breathe well. They can't breathe. Okay? So their respiration will stop. So they can't breathe. So there are many factors for this sleep apnea. One is the obstructive sleep apnea and the central sleep apnea. So whatever be the condition it is, so if the patient is having the severe sleep apnea problem, then that patient will be at a risk of developing respiratory acidosis. And if the patients are using certain medications like CNS depressants are nothing but the opioidal drugs, morphine, oxycodone. Okay, so tapentadol, dihydromorphine, and any of the opioid, codeine, and any of the opioid, then the patients will be at risk of developing this respiratory acidosis. Or if the patients are also taking the benzodiazepines, diazepam, oxazepam, lorazepam, nitrazepam, midazolam, so all the benzodiazepines, any benzodiazepine, the patient is on the benzodiazepines, then benzodiazepines, the main mechanism, like how these opioids and the benzodiazepines, what they do is, the opioids and the benzodiazepines, they suppress the medulla oblongata. So they suppress the respiratory center which is present in medulla oblongata. Opioids and benzodiazepines, they mainly suppress the respiratory center which is present in the medulla oblongata. So when the respiratory center is suppressed, then what happens? They will have the shortness of breath. When they have the shortness of breath, then what happens? The carbon dioxide levels will get increased in their blood. Okay. As a result, they will be prone for acidosis condition. That is the respiratory acidosis condition. And pulmonary edema, so it is also another factor which leads to cause the respiratory acidosis. So all these are the factors which leads to cause the respiratory acidosis. Now, how to correlate with the patient's condition? Because we have been studying about our patient. Our patient is the Bob who got admitted in the hospital and who had this acidosis condition. And we have classified, we have clearly mentioned that his condition is a respiratory acidosis. It is not a metabolic acidosis. By looking at his lab values, we have confirmed that it is a respiratory acidosis. Okay, so here, how do we correlate these factors with that of our patient? So let's have a look here. So our patient has asthma problem. So asthma itself is one of the risk factors for respiratory acidosis. Okay, our patient already he has the asthma problem. Asthma means always they will have the shortness of breath conditions, and they don't know when they have this attack, shortness of breath issues. Okay? So he's already using this Symbicort buffer for his asthma, but his asthma was not well managed. His asthma was not well managed. And on top of that, he already has the asthma problem. And on top of that, because of his insomnia condition, because he has the insomnia, that is the sleep problem. So for that insomnia condition, 5 days ago, he started taking the diazepam tablets. 5 days ago, he started taking the diazepam tablets. So now diazepam is a benzodiazepines. Okay. So now already he has the asthma, suffering with asthma, and he took the benzodiazepine tablet, that is the diazepam tablet. Okay. So both had led to cause respiratory suppression. That is his respiratory. Both has led to cause the dyspnea, that is the shortness of breath, because diazepam will suppress the respiratory center in medulla. So as a result, the patient has got this dyspnea problem, that is the shortness of breath issue. And finally, he has ended up with respiratory acidosis. Okay, so in this way, our patient has got these two conditions. Because of these two conditions, he got admitted because of these two problems. Okay? So one is asthma, but as long as he was on the asthma and his asthma medication was well controlled, then there was no issue at all. But all of a sudden, he has started taking this diazepam. On day 1, nothing happened. Day 2, nothing happened. Day 3, nothing happened. Day 4 also, nothing happened. But on day 5, he got admitted in the hospital. On day 5, he got admitted in the hospital because diazepam has got accumulated in the blood. Diazepam levels have been increased, and that diazepam has been suppressing the medulla, suppressing the respiratory center in the medulla oblongata. As a result, the diazepam has led to cause this acidosis, okay, respiratory acidosis in the patient. Okay. So in this way, we can correlate our topic, that is the acidosis and alkalosis, that is the respiratory acidosis, respiratory alkalosis, with that of our case scenario. So this is how we need to prepare for OPRA exam. Okay. So in OPRA exam, they not only ask the MCQs, straightforward MCQs, like the knowledge-based MCQ, but in OPRA exam, they will test your application skills, how capable you are to apply your skills. Okay, so how capable you are to apply the skills. So this is what that they are going to test in the OPRA exam. Of course, like 55%, they are going to ask the straightforward questions. That's the different thing. But the remaining 45%, it will be completely based on application. So if your application skills are good, if your thinking capacity is good, if you can correlate the conditions well, okay, then easily you can crack this exam. Okay. So now, guys, let's test your knowledge. So based on what will be the things that we have learned so far. Okay, so we have learned about the acidosis, alkalosis, respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. So what will be the things that we have learned? So let's try to apply our knowledge and try to answer these questions. Okay, so I will display the first question on the screen, and you guys can give the answer in the chat box, which is already open for you. So think what is the correct answer and give the answer. So here, the first question is, diabetic ketoacidosis is a condition which is characterized by diabetic ketoacidosis is a condition which is characterized by respiratory acidosis, respiratory alkalosis, metabolic acidosis, or metabolic alkalosis. So which condition will occur in diabetic ketoacidosis? Either respiratory or metabolic. Very good. So we got the first answer from Rima. So yeah, that's what it happened in case of the diabetic ketoacidosis. In diabetic ketoacidosis, what happens is the ketone bodies level gets increased. So once again, I'm going back to this previous slide. Okay. So what are the factors that leads to cause the metabolic acidosis? Okay. So one of the factors that leads to cause the metabolic acidosis is diabetic ketoacidosis condition, where the ketone bodies level get increased, and due to the increase in the ketone body levels, the patient becomes acidosis. The patient's blood pH will reduce, but the patient's blood pH is reduced due to which factor or due to which reason? Either it is a respiratory or metabolic. Okay, it is mainly due to the metabolic, not due to the respiratory. Okay, so diabetic ketoacidosis will lead to cause the metabolic acidosis. Then moving on to our second question, how does our lungs compensate in respiratory acidosis? So in case if we have the respiratory acidosis, then what our lungs they do? Either they undergo for hypoventilation, or they try to remove the bicarbonate, or they undergo for hyperventilation, that is increase in the respiratory rate, or they try to remove the protons. What does the lungs they do in case of respiratory acidosis? Yes, we got the first answer from Marine James. Very good. That is the lungs, they undergo hyperventilation. Okay. So in case of the acidosis, respiratory acidosis, it doesn't matter either in case of respiratory or metabolic acidosis, always the lungs, they will increase the respiratory rate. So why they need to undergo hyperventilation? The reason is they are trying to remove the carbon dioxide. They are trying to remove the carbon dioxide. If the carbon dioxide is removed, then no more carbonic acid will be formed. So in this way, they can they can increase the pH and bring it back to normal condition. Then the third question, among the following, which drug's toxicity leads to cause metabolic acidosis? So we got 4 drugs here. Among the following, which drug toxicity will lead to cause metabolic acidosis? Either diazepam, phenytoin, atropine, or aspirin. Any guess, guys? So here the answer is aspirin, that is acetyl salicylic acid. Again, Rima gave the correct answer. So acetyl salicylic acid, that is aspirin, is the correct answer. Okay. And all the other drugs, they won't cause the metabolic acidosis. And then the last question for today, decrease in the respiratory rate can be seen in which condition? Either in the metabolic acidosis or metabolic alkalosis. In which condition the respiratory rate will be reduced? That is, hypoventilation will occur either in metabolic acidosis or in metabolic alkalosis. So it occurs mainly in metabolic. Yes, very good. Again, Rima gave the answer. That is the metabolic alkalosis. Okay. So in case of metabolic alkalosis, the respiratory rate will be reduced and it tries to conserve the carbon dioxide and it will try to decrease the blood pH. Okay. So this is how you will be assessed in your exam. Okay, so in the examination, if you know the concept well, then you can easily answer all these questions, and this is how they will assess you in the examination. Okay? So that's it from my side for now, and again I will join later. But now I would like to hand it over to Ashrita, our admin manager. So Ashrita, if you are here, then yeah, you can just continue.
That's
Yeah.
very insightful, sir. Like most of the students were loving this. Whatever you were explaining, you have taken every student because every student experience or every student learning is not the same, right? So the main motto of Elite Expertise is providing in-depth explanation to each one of the student who is appearing for the exams. It's just like knowledge sharing. Thank you very much, sir. 2 minutes we'll be having Arief, sir, and we have the most requested question where sir will be answering it. So we have got n number of questions, guys, and we have and the time is running out even in Melbourne where Sir lives and Man lives because they have to go to workplace tomorrow again. We are providing foundation class for the KAPS and OPRA. So
Yeah.
I want to write exam in March. You wish you are you what is your suggestion? Like, do I need to enroll it now or wait for the November batch, or can I enroll it now and use the maximum benefit? One short answer, sir.
It's up to them, but there is an advantage in case if they enroll now. Okay, so because in case if they enroll now, right now we are already teaching to the current batch students, so it means that they can currently they can listen to all these lectures which are ongoing at the moment, and also when once the November, just we got only one more month left, so when once the November their real opera classes they start, it will become a bit revision for them. Okay,
Yeah.
so because here at Elite Expertise, we are charging only once a fee. So even whenever they enroll, whenever they want to sit the exam, the fees, it remains the same. So it means that we are not charging any further amount from the candidates.
Yes.
So the decision is up to them, but they will get more benefited if they can enroll now.
And how Elite Expertise is different from other institutions, sir?
Yeah, as I mentioned at the beginning itself, like we always try to be transparent with the students, okay? And always like what will be the things that we promise, we'll put everything on our website. So our results and everything, they are on the website, and the candidates, they can have a look about there.
Third rapid fire question. How did you plan for the OPRA exam session, sir? For CAPS, we had a clear cut plan. Like you have been giving training for the students. For the first batch, we have got N number of students, the resources and everything. What's your plan, action plan for OPRA, sir?
So OPRA is nothing but it is more related to therapeutics, the
Okay.
clinical part. Okay. So in OPRA, like when compared to the CAPS, in OPRA, they have reduced those non-clinical section and they are focusing mainly on the clinical part. Okay. So as we are mainly clinical pharmacists practicing here in the hospital, then we know like in which aspect, which topic is more important. Okay? And they have clearly mentioned in even in for the CAPS as well, like the normal textbook that we study is completely different, and in the examination they mainly assess about Australian practice scenarios. Okay? So even now in OPRA they have clearly changed the syllabus and they are going to add the patient care and more towards the therapeutics, so which is more towards the clinical
So
and so on.
ideally, the study material, the more like the test series and everything, it's Arif sir's brain and Harika ma'am's brain, not the any other AI brain. Is it the same? Is this the
Exactly. Yeah. No, this AI is how, like, you see, I can share one simple, best silly thing. When I was doing my board of intermediate during that time, back that time, so like there were few students and everyone they were saying that nowadays we have got the computers and internet, so we need not to go to colleges, so we need not to study anything because everything is there in the computer and computer will be teaching us. But has it happened like with that all the colleges have been shut? No, still the human brain is human brain and this computer brain is computer brain because computers are made by humans. So and also chat gpt, so for the last 4 years the chat gpt, everyone they think that chat gpt, we got the chat gpt, we'll get the answer for each and everything. But now you text anything in the chat gpt, it will provide the answer, it will provide something, but which is not completely relevant. We can't apply it practically.
correct?
So that's why AIs and all these things are nonsense. So nothing in front of the human brain, it is nothing.
And thank you very much, sir. That's very, very, very insightful. I don't know what's the time in Australia. It's 6:30 in
It's
India.
11. Yeah.
It's very, very like from bottom of our hearts. We thank you for this wonderful time and the detailed explanation, sir. And to give it just, guys, which we have forwarded one form, which is a review form where you need to just give your reviews over there, and we shall be sharing the ebook and the planner. And a special thing is that whoever shares the review of the class which is happening now on your particular LinkedIn, tagging Elite Expertise, Harika ma'am, Arif sir's individual IDs, we will be providing one free mock for you where you can actually test your knowledge of the series of your entire examination session. So yeah, I guess you can use it to the next level, make maximum use of it. Good day, Arif sir. Good day, Harika ma'am. Stay tuned. And sir, vote of thanks from your side as well.
Yeah, sure. Thank you so much. First of all, I would like to thank all the candidates for attending this session. And in case if you have any queries, please don't hesitate. You can text in the WhatsApp group as well. And we will be coming up with such sessions more in the future. So we'll be conducting more such free classes for you guys for preparing for the OPRA examination. And all the best for your pharmacist journey.
Thank you so much, sir. May God bless each one of us. Thank you, guys. Stay tuned. If you have any queries, you can actually contact us from we have a separate WhatsApp group. If you have missed anything in the group, you can actually contact us. We'll be giving all our numbers. Please try to subscribe YouTube channel. It's under name of Light Expertise on YouTube. Try to contact Arief sir on LinkedIn, Harika ma'am on LinkedIn, and don't miss for our next episode. Stay tuned. Bye bye.
Thank you. Bye.
Bye, sir.